then I will
Okay.
start my presentation. It's a real pleasure to be here with you.
I'm going to be sharing your slide quite
Yes.
quickly.
Lovely, thank you. By way of my presentation this afternoon, I'm going to take you on a journey. And that journey starts with the establishment of Black and minority ethnic networks in all NHS trusts across the country, right up to this present day. Now, I'm sure everyone present today is aware of the untimely death of the Black teenager, Stephen Lawrence. And it was as a result of the campaign of his family that the government appointed Sir Macpherson to carry out an investigation into the way that the police dealt with Stephen's death. Next slide, please. And Macpherson, at the end of his investigation, said clearly the police had failed Stephen Lawrence, and the reason they failed him was because of institutional racism. And Macpherson defined that institutional racism as the collective failure of an organisation to provide an appropriate and professional service to people because of their colour, to people because of their culture, to people because of their ethnic origin. He says the institutional racism can be detected in processes, attitudes, or behaviour which amount to discrimination through unwitting prejudice, ignorance, thoughtlessness, and racist stereotyping, which disadvantages minority ethnic people. Now, a lot of people actually think that Macpherson only referred to the police as being institutionally racist. He didn't. His report actually said that all public sector bodies were institutionally racist because of the way in which they carry out their business. When you talk about the culture of an organisation, the simplest definition is the way in which we do business around here. And what Macpherson said is the way in which the public sector does business means that it's institutionally racist. Next slide, please. Now, the Department of Health took this very seriously at the time. This is what they told us. They said, well, if the NHS as a public body is institutionally racist, we need to do something about it. And they thought the best way was to set up Black and minority ethnic networks where the staff working in an organisation can liaise and work with management to address the racial injustices that exist. That is why the BME networks were set up. It wasn't something that the Black and minority ethnic employees working in the NHS asked for. It was a government initiative to address racial injustices. And at the time, the NHS was structure slightly different to what it is today. And they had an NHS chief exec who was Sir Nigel Chris. Now Lord Chris, he sits in the House of Lords now, but he published in 2004 a 10-point race equality plan. He says, I take this very seriously. He said, this is my race equality plan, 5 points to improve services for Black and minority communities, and 5 points to develop Black and minority ethnic staff. Next slide. You see, the problem we had then was that there was no recorded evidence to confirm that the NHS was institutionally racist. And at the time, I became the chair of the local Black and minority ethnic network in Brighton. And this was against the wishes of my manager at the time. I was working as a clinical biochemist. And he actually said to me, if you touch this agenda, Vivian, it's going to ruin your career. And your career prospects are bright. He said, leave it to somebody else. But I came before God and I knew this is what he wanted me to do. So I had my substantive job as a clinical biochemist, but I also got involved in the race agenda in a voluntary capacity. And when he realized that that was what I was going to do, he said to me, as a scientist, Vivian, why don't you publish the evidence to show one way or the other is the NHS institutionally racist? Because there was absolutely no evidence back in, it started in 2004, and he put this to me in 2007 when we also established a regional network. So I took up the challenge and I did a freedom of information request to the what was then 27 NHS organisations in the Southeast, because we had a Southeast Strategic Health Authority. It was structured differently. So there was a Southeast Strategic Health Authority that looked after 27 organisations. Brighton was part of the Southeast Coast. So I did a freedom of information request to the 27 organisations and I asked for their race data. I didn't tell them what I was going to do with it, but over 3 months, I analysed it to see was the NHS in these 27 organisations institutionally racist? Next slide, please. The Health Service Journal and Channel 4 News became aware of my study. So I published the report and I gave the exclusive to the Health Service Journal. So this was the header. It got the centre spread, it got the editorial, and it got the front cover. And the head was, minority staff get worse deal on jobs, pay, and grievances. In fact, just before it was published and just before I was invited onto Channel 4 News, the chief exec, Candy Morris, of the Strategic Health Authority threatened me. He said, if you publish this, you basically won't have a job. And I had to take legal advice, and the solicitors did a spiel for me. And I gave the Southeast Coast 3 days to look at my analysis, to tell me if I'd got anything wrong, I was prepared to change it. So if my stats was incorrect, I would change it if they could show me that it was wrong. So in that time, she invited me to a meeting. Well, in fact, she summoned me to a meeting with the 27 chief execs in the region. And I had to face 26 of them because one of them couldn't attend. And nobody could tell me that my stats was incorrect. So I decided to publish the review, my review, race equality review. But I definitely became a target at that point. Next slide, please. So just so that you're aware of what the findings were from that head. At the time, BME staff made up 15% of the workforce in the Southeast Coast. And every parameter I looked at, whether it's disciplinaries, grievances, bullying and harassment, we were disproportionately represented. So what do I mean by that? If you've got 20, this is sound stats. So if you have 10% of your workforce from a Black and minority ethnic group, you would expect no more than 10% to be on disciplinaries. And yet when I analyse the data, you may have an organisation that only had 10% of BMEs working for it, 10% of its workforce was BME, but 60% of the disciplinaries were BME. We were disproportionately represented in every parameter. And then when I looked at recruitment, we were less likely to be appointed from a shortlist. And it was so stark. All the top layer of management was white, and there appeared to be a glass ceiling for all Black and minority ethnic staff. So for those of you that don't work in the NHS, there is a pay band called AFC, Agenda for Change, and that runs from a pay band of 1 to 9, 9 being the highest pay band and 1 the lowest. And what we found was that most of our Black and minority ethnic staff was at pay band 5. They just didn't progress. So it's white at the top. Here was our glass ceiling. And actually, most of the nurses that come into the NHS come in at band 5. So there was no progression for them either. And there was a failure to collect, record, and analyse workforce data or undertake race equality impact assessments. In other words, the NHS organisations were simply not interested in progressing the race equality agenda. Next slide, please. The Health Service Journal actually asked if they didn't actually believe the results. They thought maybe this is just 27 rogue NHS organisations in the southeast. So they asked if they could use my template, my statistical template, to apply it to the 235, I think it was, NHS organisations nationwide. And they got exactly the same result. So in August 2008, they published my review for the Southeast. And then in November of 2008, they published their national findings with the header, Survey Shows Racism Alive in the NHS. Next slide. And then 5 years or 6 years later, a white man publishes a report that he calls the Snowy White Peaks. And it was based on the same sort of template that I had devised. And it showed that the leadership and senior management structure of NHS Trust in London, so he just looked in London, to be predominantly white, despite 41% of the NHS staff in London being from a BME background. So he was finding exactly the same thing. The top is all white and the brown and black people are at the bottom. And because the NHS wanted to bury my report so that they could target me, their reaction to this Snowy White Peak report was, oh, this is the first time we have data that shows quite clearly that something is going very wrong with regards to the way in which we are treating our Black and minority ethnic staff. Complete nonsense. They knew it back in 2008, not just because of my review, because I'm not on an ego trip. I've suffered too much to be on an ego trip. So I'm not on an ego trip. I'm just making the point that they didn't like the accusation of institutional racism in the NHS coming out of the mouth of a Black person. Next slide, please. And the main barrier over the years, the main barrier to progress the race equality agenda in the NHS is denial. You see, although Macpherson said all public sector bodies were institutionally racist, up until July this year, you could say that the NHS was the jewel in the crown of all public sector bodies. You couldn't say anything against the NHS because it was considered to be so wonderful, and it is a wonderful organisation, but it's got many things wrong. I worked for the NHS for 34 years, and I can tell you there are lots of positives, but when it comes to our racial justice for us, there is a major problem. And it didn't help because of the denial. You can't put right something that you don't believe is wrong. Next slide, please. But the NHS had to wake up. And it had to wake up because of COVID-19. When the pandemic hit and we were all at home, we could all look at our television screens and we could all see, just by looking at the faces, the colour of the people that were dying, that they were predominantly Black and minority ethnic. So people started to ask the question, why are so many Black and brown people dying? What's gone wrong? So there we start thinking, has racism got something to do with this? And then it was that time when the tragic death of George Floyd and the Black Lives Matter movement in 2020 all coincided, and everybody was talking about race. And for the first time, what was the position of race in the NHS? Next slide, please. So the Office for National Statistics published its report. This was the first report that was published May 2020 that revealed what we all could see on the television. If you were a Black man, you were 4.2 times more likely to die from COVID-19. If you were a Black female, you were 4.3 times more likely to die from COVID-19. And the risks were higher for Asians and mixed ethnicities. And, you know, the Office of National Statistics says, well, do you know what? Even if we take into consideration the socioeconomic factors, you know, where somebody lives, poverty, the fact that in Asian households there are more people, so they're more likely to pass it from one individual to another. They said even if we take all those things, because you can factor for them in stats, you can say if I'm acknowledge that that could play a part in how it looks in the outcome that I see, if I take that into consideration, is there still a difference between the number of white people dying and the number of brown and Black people dying? Yes, there was. There was still a difference. And I like the way in which they phrased it. They said, there's a remaining part of the difference has not yet been explained. I'm being sarcastic when I say I should be. We all knew what the difference was. The difference was the racism in the NHS, but they wouldn't say it. Next slide, please. That was May 2020. At the time, there was a body, it's no longer in existence, that was called Public Health England. Public Health England were responsible for the health of the public in the simplest possible terms. So they were also looking at the ethnicity of people that were dying from COVID-19. And when they published their report, it was exactly the same. It was highest amongst Black and minority ethnic people. So it just confirmed, if you like, the report that was published by the Office of National Statistics. But lo and behold, when the government published the Public Health England report, it left out. Boris Johnson told the Department of Health to take out the section of the report that actually told us what the Black and minority ethnic stakeholders. So Public Health England had engaged BME stakeholders to ask them what was their opinion of why so many BME people were dying from COVID. They took it out. And when there was an uproar, next slide, please, they published it on the 16th of June. So the first report came out on the 2nd of June. Well, the first version of the report came out on the 2nd of June. And then the whole report was published on the 16th of June because there was an uproar. And what the BME stakeholders basically said, COVID-19 did not create the health inequalities that exist. They were there all along, but you didn't do anything about it. So you need to take, in effect, I've prepared these slides. I'm pushed for time, so I can't go for it in every detail. But it's basically, it said to the government, what COVID-19 did was expose the racism that we've been subjected to for years, right? And what it tells you now is you need to get a handle on this issue. Next slide, please. So the conclusion to report is racism and discrimination and stigma all contributed to the unequal impact of COVID-19 on BME communities. Next slide. So Boris Johnson, being Boris Johnson, was being faced with this. The UK is institutionally racist. You only have to look at it by the people that are dying. Black Lives Matter. You've got to do something about this. So he came out with the statement that he took it all very seriously, this accusation that the UK was racist. So he set up the Commission on Race and Ethnic Disparities because he said, I'm going to set up a group to look at what is the evidence to show that the BME, to show that the UK is racist. So to investigate race and ethnic disparities. The committee had 10 members, all with the exception of one, were from a BME background. The chair, Cyril, was Black. And it produced its report on the 31st of March 2021. And the overall finding of the commission is that they saw no evidence that the UK is institutionally racist. So once again, if you want to take a Black man down, use another Black man to do it. Use a group of BMEs. So Boris Johnson basically said, well, if a group of BMEs are actually telling us they've looked at the evidence and there is, there's no evidence to support the accusation that the UK is racist, then there you are, there's your answer. Next slide, please. The Commission on Race and Ethnic Disparities caused so much damage. It was an uproar, including us, from the BME organisations that exist. It really did set us back. I can't go through, but I'm just going to pick out a few of the things that it actually said that was so damning to us. It said racism and discrimination is not widespread. This is to do with health. In the health system, a satisfaction of BME and white groups are more or less equal. He said, there is no evidence of racism in the treatment and diagnosis of mental health conditions. So if there was one area of health for which there was so much evidence that there was discrimination, it was mental health. And yet this group of BME people on this commission said there was no evidence to support that. Next slide, please. And then despite all the evidence, despite the evidence from the Office of National Statistics, despite the evidence from Public Health England, look what they said at point 8. The increased risk of dying from COVID-19 is due mainly to increased risk of exposure to infection rather than race. And yet we just got the country to accept that the racism in the NHS contributed to the disproportionate death of the Black and minority ethnic staff that work for it. And they came and in one full swoop, they undid that. They basically said, well, if you're a bus driver, because we know a lot of Black people are bus drivers, then they're more likely to be exposed. Well, if you're a cleaner, you're more likely to be exposed. So they were saying, well, there are lots of other explanations that can explain why it is that we've got a disproportionate number of Black and minority ethnic people dying from COVID, and it had absolutely nothing to do with race. So are you surprised? I'm sure you're not. The government, grabbed this outcome with both hands to say, okay, we're going to address the disparities, because there are disparities between ethnic groups. He said, we're going to address it, but not on the basis that it had anything to do with our race. So finally, they said focus should be shifted to improve the outcomes for all and not centre on specific ethnic groups alone. The government was going to actually start to look at diseases that disproportionately impacted us because of our race. And because of the findings of this committee, led by BME's 9 out of 10 committee members, it decided that it was enough evidence to change its approach to our detriment. We took ourselves down. Next slide, please. Inclusive Britain is the action plan. It's the name of the action plan that Boris Johnson's government published to say that like I just said, we accept there are disparities, but nothing to do with race, and this is how we're going to address it. Next slide, please. So that was then 2020, 21, 23. Let's fast forward to this year. Despite what Boris Johnson said, this government, I don't know if you know, this country has to submit every 3 years a report to the United Nations as to how it's doing with regards to addressing racial injustices. And the report that it's submitted in July this year, and it's the main equalities body for this country, the Equalities and Human Rights Commission. They prepared the report for the UK and submitted it to the United Nations. And in a nutshell, they said for the 6 areas we looked at, so that's crime, housing, health, they said, we've got a problem. BMEs are disadvantaged. In other words, the UK is racist as an organisation, as a country. If we looked at everything, every organisation set up to deal with crime or health or whatever, they're failing the Black and minority ethnic community. And when the government submits its report to the United Nations, it welcomes a civil submission, and that was the people's submission, if you like. That was done by Amnesty UK and the Runnymede Trust, which basically said the country is racist. And we actually were one of the 23 non-governmental organisations that endorsed the report by Amnesty UK and the Runnymede Trust. So there can be no doubt about it. We've got a problem with race. Next slide, please. So what is the current position? I'm now taking you up to this present day. I never thought I'd live to see a health secretary actually admit that the NHS is broken. So I'm not promoting Labour by any means. I'm not going to make this political. That's not what I'm saying. I'm saying that there's a health secretary that has said the NHS is broken. I told you the problem we had in progressing this agenda was the NHS was considered to be the jewel in the crown of all public sectors and could do no wrong. So when I heard that he said the policy of the department is going to be it's broken, I knew there was a chance for us to progress this agenda, the race agenda. So that was the 5th of July. On the 11th of July, he said he was going to commission an independent investigation of the NHS to tell us just what is the state of affairs. And then on the 26th of July, he said, as a result of an investigation by a chair of an integrated care board, so he had appointed a chair, a senior leader in the NHS, for those of you who don't know, integrated care board, a chair of an organisation, in a health organisation. He asked her to look at the operations of the Care Quality Commission. So the Care Quality Commission is the regulator, if you like, of the NHS. It goes into NHS organisations and look how they're carrying out their business towards staff and patients. And when she looked at the way in which this regulator did its business, the health secretary decided that the interim report, so the investigation was not complete of the Care Quality Commission. It was so bad, he said, the interim report, that he said, I'm going to publish what we've found so far. And he said, based on what we found so far, the regulator of the NHS, the CQC, is not fit for purpose. Let me just take you back to the CRED. The CRED actually said that the Commission on Race and Ethnic Disparities actually said that the CQC did a wonderful job of regulating the NHS on race. Now, fast forward, we've got a health secretary that said it's not fit for purpose. We've always said it's not fit for purpose, but that was just backing up what we had said. And then on the 12th of August, you had the Equalities and Human Rights Commission. They published a report urging ministers to address inequalities faced by BME people, with particular reference to criminal justice, employment, housing, and mental health. 18th of August, the Parliamentary Health the Parliamentary and Health Service Ombudsman, actually said the worst thing we could have done was to clap for the NHS because it now believes it's a national religion. Next slide. Our response to this was a bit like what I just said. It's a window of opportunity for every Black and minority ethnic organisation, including the Nigerian physiotherapists. It's our opportunity to get the race agenda onto the agenda of this government in a serious way. And I and others in the NHS BME network actually believe, a bit like Esther, she had to go into the palace, but there was a time. It was because there was a time for her to do what she was appointed to do. And we believe that the NHS BME network was established for such a time as this. And it shouldn't leave the New Testament Church of God. Where I put that, I actually gave a similar presentation, but based on BME communities, to the New Testament Church of God 2 weeks ago. That should read, all BME organisation has a crucial role to play in making this a reality. Partnership working has to be the way forward, not for us to get the glory, but I'm going to say it because I'm a Christian, for God to get the glory out of this. Next slide, please. So I told you that the Health Secretary actually appointed, well, I didn't tell you, it was Lord Darcy, but he appointed Lord Darcy to actually carry out the independent review of the NHS. That was published recently, 12th of September. And he basically said, yes, the NHS is so broken that Labour won't be able to fix it in one term. But what Ray Streeting said, he said, today's findings will inform our 10-year plan to radically reform the NHS and get patients treated on time. The plan is due to come out next year, the 10-year plan. They've not mentioned so much staff and the racial injustices. So this is our time. Next slide, please. I'm conscious of time, but I'm going to spend another 5 minutes. You might turn around and say to me, okay, Vivian, you had the evidence back in 2008 when you did the race equality review. But where is the evidence today to show that the NHS hasn't made much progress or is still institutionally racist? So it's not Vivian. Don't shoot me as the messenger. If you work in the NHS, you will be aware of NHS staff surveys and the workforce race equality standard. And this has been in place since 2015. And every year the data tells us ethnic staff are more likely to be discriminated against in their career progression prospects, to experience bullying and harassment and abuse from colleagues, and they're less likely to be employed in senior positions than white staff. I ask you, ladies and gentlemen, do you recognise that? Is that not the same findings from 2008? So you tell me, what is the evidence to say that we have made progress? This is the evidence. We've made absolutely no progress whatsoever. Next slide, please. I'm going to give you a bit more evidence to support that. A brilliant report by the King's Fund was published on the 7th of July, where they were looking at the progression of race equality by the NHS. And they specifically said something about why they think there has been slow progress on improvement concerning the workforce race equality standard. So for those of you that don't know, every year, NHS organisations have to report on how many staff have they disciplined, what's the ethnicity of the staff they disciplined, what's the ethnicity of the staff that complained of harassment, what's the ethnicity of staff around grievances. And every year it says that BME were disproportionately represented on these parameters. So the King's Fund, in their report, said there are several reasons why there might be such slow improvement. One of them is NHS leaders do not believe that racial discrimination is a reality. Another one is there's a lack of genuine commitment and inclination to make a positive change. or maybe people do want to do something about it, but the problem's too big and deep rooted that it's hard to know where or how to begin, so it doesn't get addressed. And they said that NHS cannot afford to fail on this issue. I say to you, ladies and gentlemen, the NHS has failed. It was Einstein who said, insanity is doing the same thing over and over again and expecting a different result. If since 2015 the approach has not worked, it's not going to work if you carry on doing it now until whenever. It's just not going to work. Something different has to happen. Next slide, please. So even when an organisation is prepared to try and do something different, there's a backlash from the white colleagues. The London Ambulance Board published its board paper last month, which was picked up by the Health Service Journal. And they said, we know we're discriminating against our Black and minority ethnic candidates at interview because they're always 2 times less likely to be successful than a white candidate. So the chief executive said, well, we'll have a proposal. Every time an interviewing panel promotes a white person over a BME person, they have to tell me why. For all the jobs from Agenda for Change 7 and above, the white colleagues said, no way, Jose. They are currently considering this proposal. So when you have an organisation that says, we want to do something that could potentially change the disadvantage of Black and minority ethnic staff, the white staff said, no way. Next slide. I'm just going to quickly just go through this slide. You may, or if you're not aware, the regulator of nurses, the Nursing and Midwifery Council, there's been a report published into the way in which they've handled fitness to practice cases that have come before them, disproportionately BME. And what this review said is that there's racism and bullying and discrimination at every level in this regulator. And because there's a delay in the way in which they're processing the fitness to practice cases, during that time, 16 people have committed suicide. But I leave you to find out a bit more about. Next slide, please. And the Nursing Times actually did a review published on the 10th of June. I'm giving you up-to-date reviews to show you that the racism is alive in the NHS. And they asked every trust to give them their data of racist incidents over the last 10 years. The highest incidence for almost half of the trusts looked at was in 2023. This is evidence. Next slide, please. The first time the NMC have done a spotlight report, they've looked at what is the experiences. I know a lot of the people listening today were actually educated overseas and you came to work here. So they looked at the experience of internationally educated nurses. And one of the comments in the report is a lot of people who came from overseas now working in the NHS said they didn't expect to have to face racism and discrimination. And a quote from the report is, they raised concerns that included not feeling respected or treated the same as local colleagues, feeling as though their previous experience was not understood or valued, experiencing poor culture, gossiping, and being talked about behind their backs, and not feeling able to trust colleagues to be supportive and keep things confidential. Next slide. I'm nearly finished, a couple more minutes. And this was just more of the impact of all of that on nurses that were educated overseas. Next slide, please. So what next? You know, we've waited a long time and there have been barriers to progress this agenda. But we now have to stand up and be counted. We often talk about, lots of people talk about, oh, well, everything's about anti-Semitism, especially with this party, this Labour Party. But I can tell you, whatever you think of the Jews, they stand up and be counted. For a lot of us Black people, we worry about our jobs. And of course it's important. I can tell you personally. But we're not prepared to stand up and be united. to fight the cause. Next slide, please. And if we really want change, that has to change. Our approach has to change. We were set up to be an independent voice for Black and minority ethnic staff. Next slide. Our new approach, I'm working on our strategy, just like the Labour government, for change, hoping to publish it by the end of this year. Our approach is going to be different in the sense that we're not going to come from the bottom up in terms of we are going to be taking on board what the BME say, but we're going to be liaising with the system. So we will be writing to West Streeting and says, it's great that you've recognised it's broken. It's great that you're going to have a 10-year plan, but where is racial discrimination against our staff and patients? It's not just staff, patients, everybody. But where we went wrong last time is that we didn't, as a network, and I'm to blame as well, I was chair, we didn't establish meaningful partnerships. So when they came after us, we weren't well grounded in the sense that we didn't have as many people as we should have had on board with us. So our aim in terms of the strategy is to work with BME community groups, hence the New Testament Church of God that I'm liaising with, just as one example, and BME organisations. And I'm hoping that we can have a further discussions with the Nigerian physiotherapists to see, is there work that we can do by way of a meaningful partnership to progress this agenda? And of course, our advocates that may not be BME, but they do want to support us in getting the change that we're seeking. Next slide. Thank you. Thank you for listening to me today. Next slide. I'm willing to take and happy to take your questions. Thank you.
Thank you very much, Dr. Lefasis, Chair of the NHS BME Network. Thank you for your submissions. The data, the narrative, statistics all roll into one. Before I have the floor open to members and attendees to ask questions.
Yeah, sorry, Ademola, to interrupt. Can you take my presentation down for me, please? And then I can.
Okay. Okay. So before I have everyone else, members and attendees ask questions, in your submissions, I think slide 24, you've made reference to the current situation, which is failing. We know the submissions of the health secretary about the current situation. If I may refer to the synopsis of this event, we're talking also about the benefits of the BME population to the working of the NHS. The Office of National Statistics established increasing population of the BME population in England and Wales from 8% in 2001 to 14% in 2011. And that's still on the increase. So obviously, we have more population of this background. And there's been different studies establishing inequalities, including the reports in terms of the Black Asian minority communities in their access to healthcare. Now, the Workforce Race Equality Standard established in 2015 submitted that to improve access of these patients to healthcare, the support and inclusion of the staff of the ethnic minority is very, very crucial. So in a way, this is something that affects staff and patients likewise. From your studies, your work, what do you think could be either the most important or those things that need to change in a way to enhance what we can really say patient care and staff well-being in the current situation?
Well, there's lots of research out there that actually tells you if you've got a happy workforce, you'll have you'll have happy patients, well looked after patients. If you've got a diverse workforce, who can, in terms of the culture, they know what the BME patients are expecting. You know, when BME patients see BME people in the NHS, they can relate to us. They know that we know what their problems are. They know that we know sort of what the limitations are, like for an Asian person seeing a male doctor, woman seeing a male doctor. So all the research tells you, if you address the racial injustices that is impacting BME staff, it will have a huge impact in terms of the way in which we treat our Black and minority ethnic patients. The benefits are there. The organisations know. If you have an all-white board, trust board, how can they claim to understand, you know, what we experience and what our as staff or what we experience as patients? But if you have a diverse board, they can bring the culture to the policies, to the agendas of the board, which will have a positive impact on the way staff are treated and the way that our BME patients are cared for. But it all comes back to addressing the racial injustices that exist.
Thank you. So that is something like having a policing community where you look at the face of the policing institution to represent the community being policed. I think I can say
I can't hear you so clearly.
Can you hear me better? Okay, I think I'm relating that in the context of trust, inclusive, in a way, like a policing system that represents or that has a mix of the community it's policing. There's got to be element of trust. Similarly, you are referring here to element of trust and some form of patient-staff relationship. Am I right?
I think so. I can't really hear you clearly, but it's just that
okay.
Whatever, if you address the racial, put it simply, if you address the racial injustices that exist, it will be of benefit to the staff and benefit to the patients, in the simplest way of putting it.
Thank you. Just to quickly move forward, I will take the next one in terms of there is an agenda, and this relates particularly to the overseas trend. There's a lot more recruitment these days than has been in the previous times. We also were aware quite a number of people who are new in the country getting into situations wherein they need help. Now, one of the agenda is that most of the trade unions, Unite, Unison, and others, they've got a period of time within which you must have been a member before you present any problem. Now, for people who are just coming in, who are not aware of what these bodies even represent, they are already in the problem before they are aware of what support network is there. One of the agenda being pursued is to give a kind of reflection to these people, like give a kind of consideration wherein people who are coming in newly are given a different consideration. And these bodies can either reduce the time required before you can be supported or remove it in a way that they can then be better voice for this vulnerable population. What is your opinion or your?
I disagree with you. I disagree with you. I think I don't disagree with the fact that the the unions actually say that you need to be a member before we can help you, before you get in trouble. Let me tell you why I say that. This isn't just for people coming from overseas. Let's start with, because we know that is the position of these support organisations, then the responsibility should be on us that when people come from overseas, or even people that are here, to encourage them to join the unions just in case anything happens. So really, we should be supporting them to know this is what they need to do, just in case they need the unions. My experience is most Black and minority ethnic people don't want to join unions because they want to pay the money. All they see is, why am I paying 30, £35 to a union when I don't need them? And the same with us. So many BMEs do not join the NHS BME network, even though they could just be a support, not asking them to do anything, just to become a member. But they don't support us, but come to us when they have a problem. So we now need to take responsibility. It comes back to us. If we know that there are bodies that can help us if we get in trouble, then we need to be responsible enough to say, you know what, I'm going to join up just in case I need them. I'm going to support the NHS BME network because I believe in the agenda, but also so that when I am in trouble, I can go to them for support. So I don't think it's the unions that are at fault or need to change their policies. I think it's us. And it comes back to us taking responsibility for our future or our working conditions, or, you know, being responsible to protect ourselves. You may disagree with me, but
I mean,
I've
your
seen
opinion is
so many
taken.
Black and minority ethnic staff have no interest in the agenda until they're in trouble.
Thank you very much. I could see, please, if you have got any question for Dr. Vivian, if I have your hands up, and then I will mute. And thank you. I've seen a question pop in there in the chat. I will unmute the individual so that people can ask questions.
Yeah, and can I just ask? I'm partially deaf, so I've got my hearing aid in, and this sound is not very good, so I'm struggling. So could I just ask, please, respectfully, can you speak slow and clearly so that I can really understand? The volume's okay, but it's all a bit muffled.
Thank you. I think we can all
Okay.
understand that. I will mute Mr. Yuariba, Dr. Yetunde Dairu. Please, I'm just wondering who popped hand up first, or whoever is ready to go, please. And then, should I start with Mr. Yuariba, please? Is that okay? I'm just taking in the order of people I can see on my screen. Mr. Yuariba, please.
Thank you very much, Vivian, for a wonderful presentation that you've given to us. It has actually shared good light into what is actually happening with what we call minorities, more especially the Black minorities in NHS. And it's a good thing that people like you have been working very long time and showing that things are actually not been going in the right direction. The question I actually wanted to ask with regarding, you mentioned two or one vital point with regard to minority actually joining what's the organization that probably will be of benefit to them, maybe because of money or whatever. I totally agree with that as well. But my only question is this: it's in regards to the empowerment of the Black minority within NHS. How can organizations like you that are actually at the front line, work in collaboration with others, can actually help people that are minority in NHS to actually be more empowered and probably more awareness as well? Because I remember in a trust I actually was working before, and that was when I first heard about Black minority. It was actually put at the top agenda, and it was also to the level where they make sure that some Black minority were actually put in the executive role as well. It makes it really much easier for people to actually see what is actually going on in terms of the roles and the parts that Black minority can actually play. So my question is this: what can your organization and in collaborations with others can actually do, one, to raise the awareness more? We have cases, more especially, I wouldn't say especially within this organization, but we've had cases where people had issues. And the first thing, and it's because of your trust that I worked with before, that actually made me to question, have you get in touch with BME in your trust? That's the first question I'll be asking them. So I think one of the things is, what can we do to ensure that different organizations across the nation can actually ensure the BME profile is raised quite high within the organization, so that whoever comes in can actually come in and join them, and they'll be of help. That's number one. And the number two question is, how can we empower people like us and others that are joining the NHS to be more empowered in their duty as well and be able to speak out? Thank you. That's my two questions.
Okay. The truth is, it is IO, isn't it?
Yes.
The truth is, IO, over the years, over the last 20 odd years that we've been doing this, because I became the chair of the BME network in Brighton in 2004. This week was our 20th anniversary of the local network. There have been chief execs around the country that have done so much, like you referred to, in their organisations to support BME networks, have BME executives, give them time, give them money. And the BMEs and the organisations are just not interested. Some of them are just not because they're not interested. Others are, they don't actually believe, even if the chief exec makes a statement or the senior management makes a statement, they just don't believe that there is ever going to be any change, and they just don't engage. So it's one of the reasons why we said we're going to change our approach. When I said at the end, because we've been trying to galvanise and empower Black and minority ethnic staff to get engaged, to be part of the agenda, to stand up and be counted, and the majority won't. And even those who really know that they're being discriminated against, they turn around and say to you, and I understand, to a point, I've got to support my family back home, so I can't afford to rock the boat and lose my job. And so it's for that very reason we've decided to do a top-down rather than a bottom-up. I don't know is the answer what it would take, because we've tried everything. Even going into organisations, helping local BME networks to get what they want from their executive. The executive rolls over and gives them what they want, and then they still don't progress the agenda. I don't know is the answer.
Thank you very much. Dr. Yetunde Dairo, I know you put something in the chat, but I think I've unmute you so that you may have even more than that to ask Dr. Vivian. Please.
Oh, hi, Vivian. Thank you very much for
Hello.
Yes, I think I'll start my video so you can see my face.
Okay, yeah.
Yeah, it's quite, I always struggle with this kind of talk. I mean, I joined in late, so apologies, but I just find it so depressing. Not because I don't want to hear, it's just, it kind of makes me realize that after everything, nothing has changed. You know, I worked in the NHS for 17 years before I moved into higher education. And it seems like the experiences that I had like 23 years ago is still the same even today, which is why I find it overwhelmingly depressing. Yeah, what I want to know is, are you aware if there is an equivalent organization for higher education institution in this country as to the NHS BME?
I think there are in sort of like universities and there are, but let me tell you two people. Kahindi Andrews, he's a professor. I can't remember where he's at now. Kahindi Andrews, and trying to think of his name now. Those are the people. I will tell Ademola, and he can give you the information. I'll get the information for you. These are two people that are really championing the cause of race equality in education.
Okay.
And they will be good for you to link up with.
Oh no, I'll be delighted to be linked up with them.
Yeah.
Yes. My other question.
Robert Beckford. The second name was Robert Beckford. So Robert Beckford and Kahindi Andrews, but I'll give Ademola the details for you.
Yeah, that'd be really helpful so that we can follow it up. And also, just to ask you, how do you think we can influence things more effectively at national level? I think it's one thing for the health secretary to come out and say that the NHS is broken. I'm very cynical when I hear things like that, because politicians, you never know their motive for saying the things they say. Is it for political reason, or do they really want to make a change? I don't know. And it's not really my place to say one way or another. But I'm wondering, how can we as a group, and I hate to use the word BME, but there is no other better word.
Exactly.
I know some people say global majority, which annoys me to no end, because when you hear the word majority, it signifies strength. But as a minority person living in this country, I don't feel strengthened. I don't feel that I'm powerful. And so I even hate the majority more than I hate BME. And the reason I say about my issue with the BME is that it's very heterogeneous, and it can be used to make a bunch of people with unrelated experience together. And sometimes it's used as a tick box exercise. But nonetheless, what's your idea as to how we can influence things at a national level?
To stand up and be counted.
Absolutely.
That's one. But two, to be united. We really haven't done that. We've been so frightened. And when we actually say things as they are based on the evidence, we got our own BME people that are saying, oh, you're being too radical. We need to take a more softly approach. Do you know when Keir Starmer commissioned a report to anti-Semitism in the Labour Party by Casey Ford, I've forgotten his first name, the conclusion of his report actually says, you haven't just got a problem with anti-Semitism in the Labour Party, you've got a problem with racism against Black people.
Yeah, absolutely.
But the Jews stood up to be counted, but the Blacks haven't done the same. Yes, and it's the same for us. People say, well, how can we have change? But what have we done? And then let's put the elephant in the room. We fight each other as well. You know, we say Caribbean and African, or African. And so we don't end up standing together united. And they know that. They play on that. You know, Kemi Badenoch, whatever you think on a political position, when she stands up in government, sorry, there's my computer's running low, or is that somebody else? Sorry.
No, you're okay.
It's yours, right. It just, sorry for that. It said the battery was there. We're not united, and they take advantage of that. Could you imagine if we were united? Could you imagine if nurses in a hospital right across nationwide said, you have failed, or BMEs, just not nurses, you have failed to address the racial discrimination that we've been subjected to. So every Friday, for 1 hour, we're going to down tools. If the majority, not everybody could, but if the majority did that, and when I say that, people say, oh, we couldn't possibly do that. I said, well, the junior doctors came out on strike. The consultants came out on strike. But somehow, whenever it comes to BME and Black issues, we're not prepared to take a radical step. And until we do, nothing's going to change.
Thank you.
Thank you very much.
Yeah, I'm very much in support of that strike. I'd like to strike every 1 hour a week just to drive home my point.
Well,
thank
brilliant.
you.
Well, maybe we can bring it about. Okay.
Thank you very much. I'm quite conscious of time.
Yes.
I've got two people already have signified. One is I can see your chat, Odi. Your hand is not up, but what I will do in this case is I will just unmute you. And please, there's someone, Samsung SM S901B. I will be unmuting you too. So let me, Odi, please, you're on mute.
Thank you. Yeah.
Hi, Odie.
Yeah, thank you. Thank you, Vivian. That is really, really touching because thank you guys. I kind of, when Vivian started with 2004, I was at the beginning of all these things, and what you just said now, like standing up. And when I look at what do we understand by colonialism, and my research, I'm on my final year PhD research at Success, and I'm looking at the symbols of imperialism and why. And again, I'm seeing a lot of Nigerians in the NHS too, and they're kind of struggling, but there's no purpose in terms of how to represent themselves. And then I'm seeing again a kind of new windrush in the next 10 years, 20 years, that will be a very big problem. So what Vivian is actually kind of saying, if I'm understanding that, you can help people. Like, it's good to to be a member of of all these unions, but the BME network to be kind of, it's not like the BME network, minority black and all these things, but it's something where you can learn, and people like where it. But when I look at, I'm not a Christian, I'm not a Muslim, I am an African. But what I see, like, if we like, when you come to this when we come to understand our pain, our plight, to be able to bring it forward, Vivian, you've done it all. If I don't know, because I don't know where we can start, because I think this entanglement is so hard that everybody is trying to find their own space. Everybody's trying to, like you said, oh, my children, I need to get something home. I can't be in that kind of fight. I only came here to make some money and go back to, but you end up not going back to Nigeria. I'm just thinking, you came to my presentation in the pavilion last month. So I am still confused about the impact, kind of the psychological damage of colonialism, imperialism, and slavery has done to us. And that is the main problem, that we cannot come together. For the Jews, they have one religion, Jewish religion, Jewish. For Africans, even if they have Christian, they have Catholics here. I mean, they have plenty of, even if you have Muslim. So their heart is chartered. So I don't know what can bring us together. That's what.
But Odie, I've just said it on a personal level in terms of my own belief. But when I come at this agenda, as you know, I'm talking about us rather than a Christian or Muslim or whatever, because predominantly we had most of the people in the network were Muslims. But what I'm saying is to be united as people of color. If we were just to stand up and be united on that premise, we could bring about huge change. And I hear what Yutunde says, and I totally understand when she says that it's quite depressing, really, when you think how long this has been going on. But we can't give up hope, because I still believe, despite all that I went through and all that we as a collective are going through, that if we stood united, we could bring about change. And I don't think I'm being naive, because that hasn't happened. We have not stood united and been prepared to take real action to see if we can bring about change. If after we've done that and there's no change, then we can say, okay, there's no hope. But until we do that, there has to be hope. Thank you.
Thank you.
Thank you very much. I think we will have the next person as the last, asking the last question because of time. I'm so sorry. I'm sure we all have one thing or the other to ask. Mr. Peter Ajayi, please.
Thank you, for your presentation. The contribution I want to make tonight is just kind of a support or an idea, to move things forward.
Great.
So I'm sure you've done so many things, well done for doing that. What I'm suggesting, I have a similar, issue where I work, but I think you still need to take a step back, work with each trust at local levels, see how you can get yourself involved, because most of these guys that we're talking about, before they start work, they must have read so many things online. The fear is in them. So
Yes.
my ideas of this is, if you can work with the trust, at the level of induction, see what you can do, if you can assess them. When they put all this package together for their manual handling, for falls prevention, for infection control, if you are able, to get a slot, work with the management, let these guys understand in terms of support, let them understand that, look, there's a support for you. If you're having trouble in the social areas, this is what you need to do. So empowering them, when they about to start those jobs, or about to join those organizations, might give them some confidence, to join this association. And I'm sure you must have tried so many things. I've tried this in the past. It works very well. I get to them at inductions. The company was very supportive to give a slot, and then things start working slowly and gradually. So that's just my idea. Thank you.
Thank you.
Thank you very much.
But a lot of the trust, including Brighton, I had a slot on the induction days when they have the staff. So members of the network, I didn't have to do every single induction. We shared it amongst ourselves as a committee. We did do the induction, and you're right, it does encourage people to come forward. But on the whole, the lethargy is amongst our people, leaves a lot to be desired. But hopefully one day they'll realize that unless they speak up and stand up and be counted, then nothing's going to change. So it's about time we do it. This is the ideal opportunity. This is the time, more than ever before, we believe, for us to stand up and be counted to see change. So thank you very much.
Thank you. And am I right to say, Mr. Jayi, does that extend to BME bodies supporting, organizing some form of trainings where possible? Because for our membership as well, maybe there's a way that can be of help. I don't know. Oh, Mr. Jayi, maybe it's not there anymore. Okay. Thank you for the question. Thank you, Dr. Vivian, for the beautiful presentation. We will be bringing to a close this seminar, and to members of the NPT UK, we will be moving straight to the other platform for the business meeting. Thank you again, Vivian. Nice to have you with us.
Right. Thank you for inviting me, and I hope you found it useful. Thank you.
Thank you.
Thank you, guys. Thank you.
Thank you. Bye-bye.
Bye-bye.
Bye.
Bye-bye. Thank you. Thank you very much, Vivian.
You're welcome. Thank you.
Yeah, I'll be looking forward to the contact. So
all right, I'll make sure Adimene gets it for you.
Yeah,
they're really, really good. So I would only like to encourage you to make that contact. They're very approachable.
Yeah, I'll be getting your contact details as well.
All right, lovely. Thanks a lot. Bye-bye.
Bye-bye.
Thank you.
Bye-bye.
Bye-bye, everyone.
Bye-bye.